Welcome to Spartan Camp, Heroes of Tomorrow, where we will examine the relationship between yoga and effective literacy intervention.
As an undergrad, I did research on complementary and alternative medicine use in the field of speech-language pathology. Though there were several studies, most of them were preliminary and pilot. Even though they were preliminary and pilot studies, they still evaluated several different approaches used for various disorders. The one that really stuck out to me was the use of meditation and mindfulness with children who have learning disabilities. The research I found regarding this topic led me to the idea of doing something with yoga and children for a capstone project. After working out the details with Andrea, Danielle, and all the supervisors that helped with this project, we landed on a literacy camp that incorporates the use of yoga. This camp will be conducted for 2 weeks and will also include a day of diagnostics before and after the camp. As a within-subject design, all the students will be exposed to both conditions. The first condition is the first week of camp. This will involve reading intervention only. The second week of camp, or the second condition, will include reading instruction, but students will also participate in 2 yoga sessions each day. Our question for this research is, will incorporating yoga into literacy intervention improve students' ability to sustain attention and facilitate literacy gains? We are excited to see what we can learn from this camp and look forward to what we will find out with this research.
Reading disorders and ADHD co-occur more frequently than would be naturally expected by chance. In fact, between 25 and 40% of school-aged children and adolescents have both disorders. Research also shows that between 15 and 26% of individuals diagnosed only with RD also meet the criteria for ADHD. Future SLPs, particularly those who are interested in working with children and adolescents, will need to have a clear understanding of the dynamic between ADHD and RD, as well as how this comorbidity will present itself in the SLP realm. Eric Wilcutt and Bruce Pennington's Between Subjects Descriptive Twin Study aimed to answer the following questions about comorbid ADHD and RD. Is RD more strongly associated with inattention than hyperactivity? Is the relationship between RD and ADHD pervasive, or is it restricted to one setting? Are there gender differences between children with comorbid RD and ADHD? And does cognitive ability play a role in RD and ADHD? 494 children with RD and 373 children without RD completed a battery of standardized assessments measuring symptoms of ADHD, academic achievement of reading and spelling, and general cognitive ability. This data and the comparison between the participants allowed Wilcutt and Pennington to provide the following answers to their research questions. RD is more strongly associated with the inattention subtype of ADHD than the hyperactive subtype. This finding has been confirmed in many studies both before and after this particular study. Many people believe that children with RD exhibit ADHD symptoms because they are experiencing academic frustration. However, Wilcutt and Pennington's findings suggest that the comorbidity between RD and ADHD is not restricted to the school setting, despite common clinical beliefs. Boys with RD typically exhibit the hyperactive and impulsive behaviors associated with ADHD, while girls with RD typically exhibit the inattentive behaviors associated with ADHD. For this reason, boys are likely to be more disruptive and therefore will receive more referrals for services than girls. This finding has serious implications for the school-based SLP, which need to be addressed in future research. It was also found that children with both high and low scores of general cognitive ability and concomitant RD are at risk for all subtypes of ADHD. However, boys with low IQ and RD are significantly more at risk than their girl counterparts. It is suggested that higher intelligence may be a protective factor against symptoms of ADHD for individuals with RD. Now that we have a better understanding of the relationship between RD and ADHD, let's look at what the research says about literacy instruction for children who are struggling to read.
There's been a great amount of debate about what is the best method of literacy instruction or intervention for young children who are struggling to read. There are two main schools of thought. Explicit instruction, where teaching, explaining, and practicing the rules for phonemic awareness, decoding, and encoding is one school, and whole language is another school in which learning to read is done by reading. In the United States, explicit instruction is highly favored over whole language. However, this study was conducted in New Zealand, where whole language is the nationally recognized and utilized approach to literacy. For some children, the whole language approach works. This would be for children who have a high exposure to print and have the ability to inherently perceive redundant patterns and connections between speech and print. These children have a good receptive vocabulary, knowledge of letter names and sounds, and the ability to pre-spell or invent spellings. For other children, however, this is a struggle. They often lack exposure to print and may need more help or direct instruction in these skills. This is especially true for beginning readers. The purpose of the study by Ryder, Tumner, and Greene was to determine whether explicit instruction in skills of decoding and phonemic awareness is an effective intervention strategy for children in whole language environments who are struggling with reading. The authors began with a pool of 64 6- and 7-year-olds who were given a word reading test. From this group of 64, 24 children ages 6 and 7 who received the lowest scores on the test were placed into 12 closely matched pairs, which were then divided randomly into the intervention or control groups in 4 classrooms. The intervention program lasted for 24 weeks during one school year, and the children were given pre-test and post-test assessments in phonological decoding, word recognition in text, and reading comprehension.
Following intervention, students, teachers, and parents reported lower state and trait anxiety scores. It was also noted from teachers and students alike that social skills significantly increased following the 5 weeks of mindfulness meditation. Though this is only a pilot study, it does show the feasibility of using mindfulness meditation as an intervention for students struggling with learning disorders.
This was an experimental between subjects design. Results of the study showed that gains were made by both groups. However, the intervention group performed better on every measure than the control group. The intervention group on average performed only 2 months behind age-appropriate levels, whereas the control group was 10 months behind. This suggests that intervention was successful for the struggling readers. In addition, 2 years later, data from tests of 10 of the pairs showed that the intervention group maintained positive effects and had generalized to word recognition accuracy in text.
So I'm going to be talking about our third article that kind of ties all of these areas together. My article looks at improving social skills, anxiety levels, and academic performance in children with language disorders. I really like this article because though it looks at older school-age students, it ties together our idea of using meditation techniques like yoga with students who have learning disabilities. In the intro of this article, it talks about high levels of anxiety and school-related stress being associated with learning disabilities. There are 2 causes of this anxiety and stress that are discussed in the article. The first is deficient knowledge and awareness that the student is unprepared. The second is a model of cognitive interference that talks about problems with attentional focus, concern about competence, or experiencing preoccupation with self-oriented and negative thoughts. Despite the origin, the investigators believed that mindfulness meditation would help academically, as it is said to stabilize the mind and develop the capacity for attention to move naturally among changing elements of experience. Just a quick note on the background of this study. The authors made note about studies done with anxiety and meditation and social skills and meditation, and there weren't very many. There were a few peer-reviewed studies on treating anxiety, and then there were even fewer looking at treatments for specific types of anxiety. There was one, I believe, that looked at state and trait anxiety, but it was unclear as to whether that was an appropriate target for meditation. And there was one peer-reviewed study looking at social skills and meditation, and it indicated a positive effect, but it was only one study, so it must be seen as tentative. For this study, the investigators looked at 34 students from ages 13 to 18 years old. 2 teachers were also involved in the study, and all the students involved had a primary diagnosis of LD. 53% of the students reported that they had at least some experience with meditation, but none of the teachers had prior experience. The measures used in this study were the social skills rating system, the state trait anxiety inventory, and attitudinal questions. The social skills rating system is a multi-rater approach that compares the student, teacher, and parent ratings. The state trait anxiety inventory is a self-report measure. The attitudinal questions were also self-reported. As this is a pilot study, it had a pre-post no control design, meaning that it had no control group and gave assessments before and after intervention. The teachers and students both received training. Teachers received training with the primary investigator with a mindfulness expert for 2 hours in one training session. The students received 2 45-minute training sessions that were provided by the primary investigator and the teacher. Although they were provided at separate times, a standard procedure was used to ensure similarity between teacher and student training. The intervention consisted of 5 to 10-minute meditation sessions at the beginning of each class period. This happened for 5 days of every week for 5 consecutive weeks. Following intervention, students, teachers, and parents reported lower state and trait anxiety scores. It was also noted from teachers and students alike that social skills significantly increased following the 5 weeks of mindfulness meditation. Though this is only a pilot study, it does show the feasibility of using mindfulness meditation as an intervention for students struggling with learning disorders.
After reviewing our research, we propose that participating in yoga prior to speech therapy will improve students' sustained attention during therapy tasks, which will improve their overall reading performance. Our research will focus on students ages 6 through 8 with concomitant attention and reading disorders. As we learned, students with attention disorders are likely to have reading disorders as well. We will be using explicit instruction as this approach has shown to be more effective with students who struggle with reading. To reduce anxiety and school-related stress that often occurs in students with learning disabilities, we will be incorporating yoga and meditation into the second week of camp. We are interested to see if decreased anxiety and intentional focus during meditation will improve response to intervention.
Thanks for listening to our presentation. Here are the references for the articles we reviewed, and we have a few more articles if you're interested in the topic. We are so excited to examine the effects of yoga on literacy intervention with our students this summer.